And so if they can't do that, we failed them. You know, it was kind of heartbreaking hearing her talk about, I want to surf again, bike ride, running 10 miles a pop, to doing nothing. That a patient calls and says, you know, what do you have for, you know, my son or daughter suffering from this, or they have mono or whatnot. I think the biggest thing is, you know, it's always prevention over reaction. What's up, Matt? Welcome back to the show. Talk to me. What do we got today?
Good to be back. So I want to dive deep, go right in. So if you were to give me 2 therapies you've done to basically accelerate recovery and shorten the time of recovery and wellness, what would be the first therapy you would give?
No brainer for me. The first 2 modalities that I use both on patients and myself that blew me away were pulse electromagnetic field therapy and shockwave or acoustic sound wave therapy. PEMF is an animal into itself, and being somebody that works at a national, international level with the product, hearing the chief science officers and even how they talk about it, it's science, and you need to be able to explain it in a keep it simple method to get people to understand it. And for me, what I love in that one is I literally use Gary Brecka's explanation of just, you know, the reinnervation or re-energizing the cells so that you optimize your energy within your body to do all of the healing properties. As far as shockwave, that's acoustic sound wave therapy. That's that's an actual physical modality that you're gonna have a physical response. I love it because whether it's a tight calf or a tight muscle, a tight glute, a pulled hamstring, a shin splint, we can go in and affect the quality of the soft tissue and break up scar tissue, accelerate healing, and really turn an injury that could be a 4 to 6 week lingering injury into a matter of hours and days.
Right. Amazing. Now to combo both the shockwave and PEMF therapy, what would you say to your listeners? Why is it so important to combo both as opposed to just doing shockwave or just doing PEMF? Why do we need to do both?
Great question. So we get that during our patient intakes all the time. And they'll ask us, you know, why is it that you approach the core 4 in the manner that you do? And for this dynamic duo, what we tell our patients is that we utilize the PEMF technology to calm down an area, accelerate healing, cellular energizing, and if you will, and bring the tissue back to its optimal level of health so it can heal, so that it can respond, recover, it can be rested and put you into that state. The shockwave is, it's the peanut butter to the jelly, so to speak, and with the shockwave, when we go through, one of the best explanations that I saw, one of the experts that's actually a global acoustic sound wave or radial pulse wave shockwave therapist teaches it and certifies people in it, is he would use a hypervolt or another Theragun device to find the spots on the patient.
Right.
And when he'd go through, or the athlete, right? So in a clinical setting, he worked with pro soccer teams. And when he'd find these spots, he then would take the acoustic sound wave and clear them out. And so you see that myofascial response, and you can watch the participant, the patient, literally go from having this hard, palpable mass they've described as a ball or a spasm to being flat, and then all of a sudden experiencing, significant and immediate relief.
Right. And that's basically what separates the shockwave, if I stand corrected, because it gets about 4 to 6 centimeters deeper
in depth.
Through the
yes,
tissue.
Absolutely.
Yeah.
So they're going to feel that. A lot of times for me in the clinical setting, I'm all about, communication, eyes, contact, and, trying to touch all the senses. You see it, you feel it, you hear it. And when they hear the shockwave go on, especially if I'm working on anything on the backside of them, the posterior aspect of them, I show them first. I put it on their hand, or I'll put it on my hand, so they feel it. Because when you fire up that machine and they hear click, 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 click from behind them, it startles them.
A little scary.
Yeah, and so we want to, give them the assurance and reassurance that they're okay. This is what it feels like. This is our why.
Right.
And this is what you're going to experience, and the outcome is going to be this.
Right.
And I have to say, with a high percentage of certainty and confidence, that we get those patients there, 95% of the time.
No, absolutely. And what's amazing about shockwave is patients ask us all the time, what does it feel like? Essentially, we hate doing it on them because we want it to be uncomfortable. right? Because that means you're hitting the right spots, you're targeting the right areas. How would you explain it to your listeners, the difference of the feeling of shockwave to PEMF?
So the PEMF technology for the pulse PEMF that we use, you hear a clicking sensation. And depending on whether they're on the full body pad or an extremity piece or the coil, when you hear the click, you feel that pulse sensation or that thump that travels through your body.
Yeah.
Although, the studies and the description of the technology, so you can cover a 3 to 6 foot surface area, the area that's coiled, wrapped, or treated, you feel it the most. The PEMF, you'll feel it. It doesn't. We have never had a patient say they feel pain from it.
Right.
Now, the spark gap technology that we used before, that definitely hits different, but that has a use. If a person has an extremity complaint, our outcomes with that machine are superior.
Oh,
we love
amazing.
it, and then the patient feels it immediately. But, if I'm paralleling that or comparing that in a dichotomy between shockwave therapy, when we're going over those areas, I'm very clear and descriptive in saying you're going to notice when I work over an area, especially a larger muscle group, that you're going to feel a tapping in an area that there's healthy tissue. And this is our version of truth serum. When I get to the area that hurts, you're going to know. And what I usually do in the series of treatments that I've prescribed is I build up their tolerance to it, because not only am I dissipating or reducing the muscle spasm, the tear, the injury to the area, but I'm also conditioning them to the apparatus and how it feels.
Right.
By treatments 2 or 3, it's intriguing to see that the tapping or the clicking sound isn't startling them, and the contact to the skin surface in the affected area is significantly more enjoyable and gives them relief, which is our desired intended result. But, that's all about patient explanation. And we always talk about that in our centers. And I pride myself on knowing that my team does a great job with this, is communication. And when we communicate with them, from everything from the intake process to the actual treatment, it's remarkable to see how they respond to it, because they know it's coming. They're like, okay, it wasn't that bad. I expected it to be worse. And sometimes I do that. I like to paint the picture like, hey, this could be terrible.
Absolutely.
And when it's not so bad, and I had a patient today that was an awesome story. She's a visual graphic designer. And I believe since February of this year, even before that, she had really been struggling with stuff. And, our goal is to reduce the pain significantly, get her to be able to work in front of her face or over her head with designing artwork, and get her back to doing stuff she loves and wants to be doing. So, I think that's a great question. I think the soothing effects of PEMF, and, the big thing on PEMF that you see, and whether it's, the Gary Brecka's out there, or the, these recovery institutes that are all over the world, and, and it's big in Europe, is they use it in the morning, or they use the weaker dosage PEMF for sleeping relaxation. So the treatment range is very wide with PEMF, because there are so many fantastic healing properties to it, that I think that the PEMF is obviously the soother, right? That's the hot shower, right? And then the shockwave, and that's why a lot of times I'll call it acoustic sound wave or radial pulse wave, because sometimes it does have exactly that effect, and it shocks them.
Right.
And so if we could put them in a setting where they're calm when they're delivering a treatment that, let's be honest, they called in, they made an effort, they've allotted money for this, they're investing in their healthcare because of one reason. Pain. It hurts. So you better be excellent at explaining to them, I'm bringing pain to the area for a intended result.
Right.
And when you do that with confidence, with clarity, and an explanation they can get their head around, the treatment and the whole experience is that much better for both the patient and the provider.
No, absolutely. Great answer there. And I hear it all the time. Even the patient today was asking, I come in for my shoulder and you want to prescribe shockwave on that. Why is it so important to tackle a few different areas besides pinpoint the shoulder? Like go into the QL, into the lat, around the shoulder to build range of motion. Why is that so important?
It's a fantastic question. We're blessed to be working with these companies internationally, and they're working with professional athletes on a regular basis. The amazing thing is that I believe a lot of these manual therapists that are using these devices is trial and error, and they have these pro athletes who are their money. They're their
Right.
professional horses. They need to be on the field playing.
Yeah.
And when trainers aren't doing their job, trainers get replaced, right? And so the athletic trainers working on them are desperately working to find areas, and they start having breakthroughs saying, hey, you know what? If I release this guy's hip on the opposite side of the shoulder, they're getting the relief pattern. So we talk about it as a multifaceted approach, but the reality is just usually it's the biomechanics. There's a deficit somewhere, a weakness, a strength that's causing the body to be pulled out of balance, if you will. When we can calm and release these areas, then we seem to get them back to homeostasis or feeling, 1,000%, significantly faster.
Right. Awesome. Great answer to that. Just fueling off of PEMF and Shockwave, one more super important question. Once a treatment plan is done and a patient gets to where they're feeling about 70, 75%, still not 100 just yet, as far as maintenance for a treatment plan, how would you prescribe that? How would you treat them? Once a week, twice a week, once a month?
Great question. So we basically move them through like the phases of care: acute, subacute, chronic, and then wellness. At 70% and they haven't performed or done athletics, training yet,
Right.
we're guarded. And how we write that up when we're talking to them or discuss that with the patient is that it is critical path that we must test it.
Yeah.
So a lot of times in that setting, especially if we're treating out of our bigger facilities where we have access to a basketball court or turf, we test the athlete for one reason. Their measure of success is their ease back into their life, whether that's sports, recreation, leisurely hobbies.
Their getaway is their therapy.
Correct. And so if they can't do that, we failed them. So my feeling is the best way to show you is that I'm not going to pull the rabbit out of the hat. I'm going to make you do it. And when you can do it, you realize that you're like, oh, I can do this, right? I need the patient to see that and say, Doc, I feel amazing. And we had that, I don't want to say last names, obviously, because of HIPAA and all our different medical things, but we had a patient that had a complex fusion that had all kinds of weird neurological stuff. And so he was limited with regards to treatment we could do.
Yeah.
I love these type of testimonials that we can sit here because it couldn't be a better advertisement. Here's this person that had a complex fusion that had got back with all kinds of discipline training and is in freakishly good shape. And he got away from his rituals, routines.
Right.
Came in a panic because he's like, oh my God, do I need another surgery? And sent him for a structural x-ray. Everything looked intact. Sent him to the spine surgeon. They looked intact. And we had to calm down the nerves. So we took that dynamic duo, if you will, with the PEMF and the Shockwave.
Yeah.
And the best tie it all together and bring it back and circle it he was that case. He got great relief from the passive modality of the pulse electromagnetic field therapy in that soothing, relaxing, calming the nerves. But when we started realizing when we were ortho testing him or testing him through his range of motion, he was compromised in his internal and external hips. So then we put the Shockwave or the acoustic sound wave to the test, and we started working the outer thigh. We started working the posterior chain or the back muscles and the hamstring. And that was the aha. When he came in the next day as an elite athlete of any age, but as an older athlete, he was blown away with the level of relief, with the symptomatic break, and the increase in range of motion. Once we found out to that was like our science discovery that everything's interrelated, right? A lot of muscles work in X patterns. So if we can get in there, we can release these areas and then show them movement patterns that are healthy in almost like a ABC, like you're learning how to walk. First, we're going to crawl, then we're going to walk, then we're going to jog, we're going to run. And when they see that, what an amazing thing. So at that 75% for him, additionally, we may prescribe a little bit more because at 85, 90%, I'm confident I can let that patient go and resume athletic performance in there. 70 seems to be that magic number. And that's why I have to ask them for an honest answer. And why? If they're anything like me, if I'm at 50%, I'm going to lie to you and tell you I'm at 80% because I want to train.
Right.
I want to perform. I want to work out.
Keep going.
And so our best thing, and I think one of our tools that, a combination of our CSCSs and our ATCs, and of course our clinical providers, is that we show them because it shows we care.
Right.
And I think when you lead with that, like, hey, let me show you what you can do. And I love a chest bump and a high five. They can do everything and they don't need me.
Nothing better than
we
that.
did our job. We need a testimonial and put it on the wall of fame that you guys did it. We're celebrating the win together.
Right.
If they can't do it, we usually say, hey, listen, unbelievable. You could barely walk a week ago.
Yeah.
You're almost there. this is my idea of how we're going to get there. Can we get you on board with this? And when they look back, because we put into their head immediately, I couldn't walk last week. I felt like I could train. It's 8 days later.
Yeah.
I trust them.
Right.
Right. And that's that discovery process. That's communication. And then with the science doing what it's supposed to be doing under the proper treatments environment, you're going to get results that get you to the notoriety that we're at now, where, patients have complex regional pain syndromes. They know what to do. And they're trying out these modalities that you hear us talking about all the time on our Velocity Performance page. And they're having some amazing breakthroughs in healing.
And the shockwave is great. And I'm keeping it going because this is fire right now. So when it comes to the shockwave, we had a patient come in. We treated him for 3 sessions on the shockwave. He had golfer's elbow for about 10 days. And he was thinking about it. He was like, I'm going to wait it out a week. Next day it comes back. He's like,
I'm dying.
Oh, this is killing me. So you prescribed him 3 shockwave treatments, kicked it out real quick. He's as happy as can be. What's your advice to somebody listening or watching right now if they get a quick, acute onset injury?
Getting it treated.
Might sound silly, but do you wait a week or go right in?
You know what's funny? The one thing we know our body. Deep down inside, we know our body. And some of the best medicine is barstool conversation or locker room conversation.
Yeah.
Asking another athlete, hey, how you doing with your elbow? Man, it's been killing me for 12 months. Heard. Makes me laugh. Because when it becomes chronic, now you have fibrotic scar tissue. Mm-hmm. Now you have biomechanical stress and changes in range of motion and all these different deficits that happen. And now we're dealing with not only the recovery, we're also dealing with the aging process and how fast the body will heal. And so that's when we always say, okay, we're going to prescribe somewhere between 15 and 20 hours on PEMF. Mm-hmm. We get them in that acute stage and the tissue hasn't started remodeling yet and it's just inflamed. We'll utilize something like our local cryotherapy, target the area and pull that temperature way down in that area and let them know that we're going to use this as a natural analgesic. We're going to soften the pain area there, and we're going to...
Which I did before you lit that elbow up.
Absolutely. And Carl's not only a patient of the practice, but he's a dear friend. And I have to tell you that he was blown away because the sensitivity of leaning on it and training on it is almost gone.
Yeah.
And I explained to him that one of the post-treatment responses is a little bit of ache and pain. But when he said he can lift and train and do everything and he doesn't feel it at all, versus he couldn't even do a tricep push down or a bicep curl, right. I said, well, think about that.
Yeah.
We talk about celebrating small wins, but that sounds like a major win to me.
That's a huge win.
So I think we have one treatment left. He's right where he needs to be.
Yeah.
And to your question before, I said to him, and I always like to lead with this, Carl, if you feel you're at 75 or 80, above 80%, you don't need us. Wear the IncrediWear sleeve. Mm-hmm. Even at nighttime, it's even better. You get more hours on the anti-inflammatory properties of the sleeve, and then wear something supported while you're training. Do that for, 1 to 2 weeks, and this condition should be gone.
Right.
If you're under this 70, 75%, we'll sneak in another treatment or two, and we'll get you to where you need to be, and you'll be back to normal activities without restrictions.
Right.
I think the unfortunate problem is most people are procrastinators, including myself.
Yeah. As am I.
And everybody's too busy.
Yeah.
And then it winds up becoming a fire drill. And now you're dealing with reactionary versus preventative medicine.
Now you're coming in 3 times a week for 4 weeks.
or 8 weeks. And they don't realize because we've seen it. And we see our success rate when we don't prescribe that way to be very low, because what happens is when we underprescribe, then they set their expectation, I'm going to be better by Friday.
Right.
And I love that. When I was paralyzed, I think the one thing that always used to bring a tear to my mom's eye was, and it was a good amount of weeks and months that went by that I really was struggling, that I was like, hey, Mom, and I give her a kiss, like, I'm going to be better tomorrow. And I think that's really what the human condition is that we do have that innate energy to want to say that we're going to be better. Everybody's that way, right? But the reality is sometimes we need science, sometimes we need technology, 100%. Sometimes we need rest, sometimes it's nutrition.
And you're teeing me up. It's a proven science, right? So back a few minutes ago, you mentioned 15 to 20 hours on PEMF, depending on injury. Why is it so important to where you need to accumulate hours on PEMF therapy in order to get full recovery and healing?
So we go by that's a great question. We go by the research there, and there's a lot of, whether it's the National Institute of Health or, these different published medical journals that are studying these devices, and whether it's universities, and what they're seeing is that for chronic multi-regional pain complexes that the patient is optimized, or the healing factors, they multiply in success
Right.
by the increased hours on the machine.
Yeah.
I know for me in personal experience with the Guillain-Barré syndrome and the different injuries that I have, I definitely accumulate, 10 hours a week on the machine.
Yeah.
And it allows me to perform and train at a level that I haven't touched in years.
Right.
I mean, I tell people all the time that my body fat sits between 4 and 7%. I'm eating like a horse, but I attribute my success in my discipline, in my recovery. One of the things that, I think I literally bombard the social media world and my 4:30 a.m. crew with, that's my time.
Yeah.
That's my time to get my recovery in, because, at 7 a.m., it's all about our patients. It's all about everybody else.
Yeah.
So great question. I hope I answered it.
Yeah, no, absolutely. And that's so important, because when we're explaining it to patients, they're thinking they just want me to do all these treatments, this and that. But at the end of the day, when we write up their treatment plan, when we fully explain, listen, your injury, you need to accumulate this amount of time to be successful with your recovery and healing, they understand it. They understand the science of it, especially after reading the articles.
100%. And, patient education is everything. Let's close on this. Patients will come in all the time. And when you take them through the history and the examination, listening, truly listening, is one of the most powerful medical tools we have as healthcare providers. And a lot of times, I heard, it's being in the international world with podcasts, you subject yourself to people coming out at you that you're not a real doctor as a chiropractor or a chiropractic physician, and my differential diagnosis ability has been exceptional over the years. And I know my audience that knows me in our immediate community knows that I'm not one of those people that's going to keep you if you need to be treated and it's a surgical issue.
It's a title on a paper. It's what you physically do and say to that patient.
100%. And, that's the one thing that resonates with me, that I love the feedback that a patient calls and says, what do you have for, my son or daughter suffering from this, or they have mono or whatnot. So I do believe that during the process and in the treatment process, whenever you can get to the patient and break it down for them and really educate them,
right,
I think that's when you're going to have those breakthrough aha moments where they're like, I trust them.
They feel like they're home.
The patient today was, was frustrated, was defeated, and was remarkably tough because she kept herself together. We had a really awesome heart-to-heart conversation. It was a good, way longer than my normal examinations as far as that, because we spent the first 25 to 30 minutes discussing the journey that got her there. And, it was kind of heartbreaking hearing her talk about, I want to surf again, bike ride, running 10 miles a pop, to doing nothing. And, I leveled the playing field, or made her feel my vulnerability, where I was like, I was going to bed at 1:00. I wasn't sleeping. And she's like looking at you saying, this was the journey back. Yeah. And I have a long way to go.
And that's the thing. We all practice what we preach. It's one thing to say they should do something, but when we do it ourselves,
we're living it.
Really.
Yeah, absolutely. So a great question. I think the biggest thing is, it's always prevention over reaction. If you do wait, the one thing I would say is our care plans are extended. But that's because we're treating multiple areas and we need to get you back to where you need to go so you get to do what you want to do in life.
Right.
So, Matt, thank you so much for today. Great questions.
Always a pleasure, Doc.
I always love jumping on the podcast with you.